Now, the Eastern Cape Health Department has expressed shock and concern after a 12-year-old girl gave birth at a health facility in Komani at the Chris Hani District Municipality. Now, the young girl's baby is among the 44 born yesterday in hospitals across the province. Let's speak now to the Eastern Cape Department of Health's head of a department, Dr. Rolene Wagner, who joins us live now. Good evening to you and thank you so much for your time. Your heart must have sank when you were told that there's a 12-year-old girl who's given birth.
Yes, thank you. Good evening to you and the listeners, and compliments of the season. Yeah, it was a shock to us. It is a disturbing trend that we have young girls aged 10 to 14, 15 to 19 who still fall pregnant despite our efforts.
And what are you finding as the department is behind this? What, is it something that we are not seeing, or what exactly is going on?
Well, I think maybe what we should do is just start with what our roles and responsibilities are as the Department of Health. And so our role is to identify if there is, in terms of the Child Protection Act, it's to identify if we have any suspected cases of abuse, and teenage pregnancy is such a case that we would be required to report on. It's also our role to provide care and to report it to the designated official, whether it's the police services as well as the Department of Social Development, and they would then take it further. Also, in a case where we believe that there's been some form of abuse towards the child, we complete a form, but we also document evidence that can be utilized if we then proceed to the criminal charges. So in the case of the 12-year-old, I could perhaps use that to illustrate what our role is. The doctor who first saw the child, in line with his responsibilities contained in the Act, he did report it to the police, and a case was in fact opened by the doctor at the hospital. The police, the young man, it's a 17-year-old who is also underage, and he has already appeared in court. And so police services will be managing that, and it will go through the required processes. But as a health department, we also work with other government departments, as well as working with our NGOs and with our local community leaders in trying to prevent teenage pregnancies, empower young girls so that they're able to exercise their rights, empower them to make decisions about their sexual and reproductive health, and then give them access to family planning to prevent teenage pregnancies.
And, you know, be that as it may, one would then ask the question, I've got two follow-ups, and I'll start with the first one. Have they reported any other cases? And I'm talking about healthcare workers here, because when we think about the fact that we knew of this young girl because of New Year's Day, authorities are there, the MEC would be there, and of course this information will come to light. But one thinks about other days when the cameras aren't there and they're not rolling. Have the health officials been reporting these matters, and what has been done?
Yes, thank you very much for the question. So the health officials do report the cases. I think what happens on our side as administrators is we are tracking all teenage pregnancies that are delivered at our facilities, age 10 to 14 and 15 to 19. But as our Honourable MEC observed, it's as much as we are reporting that statistics and then following it up, at the moment that a young woman is pregnant, is identified and gets brought to us during the antenatal care program, that is the point at which we should be regularly collecting statistics, working with the Department of Social Development and the police services to make sure that we reach out to the victim, because she is a victim in this case, that it gets investigated appropriately and that the correct procedures then follow on from that. It is a coordinated approach. As much as we raise, we have an obligation to report on it, provide care and provide the medico-legal evidence. We do work with social development to provide social support to the victim and the family, as well as with SABC, who then proceeds with any criminal associated proceedings. I agree with you, as our MEC has said, that perhaps we should be more overzealous in monitoring it up front, not just only at the point where the young child is now delivering. We should be monitoring the statistics a little bit earlier so that we can intervene earlier and make sure that everyone is brought to book.
And I suppose maybe it also speaks to what you've, spoken about earlier on as well, around the campaigns that you as a department and various other departments are working with. Maybe intensify that and see if families come on board? Because certainly things are desperate now. If the latest stats, for example, are saying 1 in 4 girls under the age of 20 is pregnant, this is a crisis. Honestly, it seriously is.
Yeah, in our province, because our previous MEC Meth was quite passionate about this as well. And so in the last 3 years, we have been working together with the Department of Education, as well as the Department of Social Development and the NGOs who operate in our province. We've identified which districts it is a particular problem in, and we've gone down to community level to work with communities on that. I would agree with you that we can intensify the community-based level at which we engage. It is an entire society approach, and we all need to take responsibility for it down at that level. The good news is that we've started seeing a downward trend because we've increased the campaigns. We've increased the number of youth zones so that young people can exercise their right to prevent pregnancies. Not that we're encouraging them to be sexually active at this stage or say that it's appropriate, but we do want to give them the power to make decisions about their reproductive health. And so in the last 2 years, consistently, we've had a reduction in the number of teenage pregnancies across our province. So we're heading in the right direction. It's just that we should not be having 16,222 young girls falling pregnant in the first place. So it does require a whole of society approach in working with us in empowering young girls and also bringing to book those who are involved in statutory rape, because that is what it is when a young girl's under 16 and she's pregnant.
And what role then do traditional leaders also play? Because, there is a call for them to now also be active here.
Absolutely. So in our province, that again is something that our leadership at the Office of the Premier is quite passionate about, and we will be stepping up our activities. We have a group, the IYA, where we work with the wives of traditional leaders who are also passionate about preventing teenage pregnancies and about empowering young women to make decisions around abstinence, etc. So you're quite right. As we work on these social determinants of health, it's working with community-based leaders, working with traditional leaders who have a lot of influence at a local level, at a community level, and of course working with our councillors who work and our district health councillors to try and address the scourge that we face.
And I suppose it's also because of the fact that, tears well up. You really become teary when you think about a 12-year-old. It's such a fragile body. For it to then go through a pregnancy and deliver a child and then get to a point of being a mother when you are still needing to be a child yourself.
Absolutely. I mean, just yesterday, I joined one of our MECs at a local hospital, and we had a 15-year-old. I held a baby, and we try to be positive and supportive because in a way, this young mother herself is a victim. And it touches your heart because you think about how her entire child is now affected because she's got to become a mother and care for another young child. I mean, it becomes a cycle that she could potentially be trapped in. So we really need to break the cycle so that we give young girls an opportunity to live fulfilled lives, to fulfill their potential, and not to have to become a parent way ahead of their time. Not to mention the physical charge that it has on their bodies. Because as you say, their bodies are not designed to be delivering babies at that, firstly, carrying a baby through pregnancy and then delivering.
It certainly is quite heartbreaking. Thank you so much for talking to us, Dr. Wagner. Appreciate your time. That's the Department of Health's Head of Department in the Eastern Cape, Dr. Rolene Wagner. And really, just as we stay with this particular story, we really are needing to look now at the role that traditional leaders also play when it comes to ensuring that we deal with this once and for all. And Kgoshima Tupa is Contralessa's president and joins us live now this evening. Kgoshi, good evening to you, and thank you so much for your time and compliments of the season. Certainly quite heartbreaking when you think about what is taking place and you listen to some of what is coming out of different provinces on Christmas Day, on New Year's Day. Children are giving birth, and this really just does raise alarm bells on what exactly is going on in the country. It's not new. We've been seeing this over years now, and one wonders what is being done to be able to deal with this.